Today, Pet Therapy and Oncology with Lyn Filip, RN, BSN, OCN. I've had a quote that I liked. Mayo Clinic oncologist Dr. Edward Cregan says, "A pet is a medication without side effects that has so many benefits. I can't always explain it myself, but for years now I've seen how instances of having a pet are like an effective drug. It really does help people." And I hope that helps set the stage for our presentation today. Uh, Let me say that Lyn Filip, RN, BSN, OCN, is a clinical assistant professor and nurse clinician in the Division of Gynecologic Oncology. She's a repeat presenter here with the UNC Lineberger Cancer Network, and we're so glad to have her back. She directs patient care for patients and families and enjoys facilitating a team approach to comprehensive patient care. She also likes her role as an educator of nurses, residents, and fellows. Lyn also has a certified pet therapy basset hound named Herbie, and they work at UNC and at the Ronald McDonald House. Lyn has been at UNC for 15 years. She enjoys working directly with patients and families in all aspects of gynecologic oncology care. She co-directs the chemotherapy course for the Gyn-Oncology Fellows. Lyn is also involved in inpatient resident education. Lyn, welcome. Thank you so much for being here.
Thanks so much, Tim, and to everyone who helped on this presentation. I appreciate it. I always do. I'm probably known for changing my title at the last minute. So when they put out their flyer in the beginning, but we are going to talk about pets and on oncology. So we can go to the next slide.
Right. And Lyn, what's one thing we should know about you outside of your professional bio there?
Well, you have my professional bio is really, you're going to hear all about me with Herbie. And I'm at home today with him, so he gets to participate in this. So also any questions that you have during this or at the end of the presentation or afterwards, I'm happy to answer.
Great. Thank you so much. I mentioned poll everywhere. This will be our first question, which will pop up in just a minute. What kind of dog is Herbie? So we're going to test our audience's knowledge of different breeds. A, Labrador, B, Beagle, C, Basset Hound, or D, Great Dane. So in just a minute, I'll pop that back up and you can go ahead and answer that. Before I do that, I want to say that this activity has been planned and implemented under the sole supervision of the course directors in association with the UNC Office of Continuing Professional Development. William A. Wood, MD, MPH, and CPD staff have no relevant financial relationships with commercial interests as defined by the ACCME. Greensboro Area Health Education Center is approved as a provider of nursing and continuing professional development by the North Carolina Nurses Association, an accredited approver by American Nurses Credentialing Centers Commission on Accreditation. Lyn Filip, RN, BSN, OCN has no relevant financial relationships with commercial interests as defined by the ACCME. And here's that poll. What kind of dog is Herbie? So A, Labrador, B, Beagle, C, Basset Hound, D, Great Dane. We're running strongly in favor of C here. Lyn, how are they doing?
They're doing well, and I did put Beagle in to try to catch someone, so thank you, or else it wasn't worthwhile. But Herbie is a Basset Hound, and you can kind of see the Beagle is a little bit taller and not those big ears and not quite as big on the nose. So he is a Basset Hound. He would love to be a Great Dane, though.
Great. All right, I'll turn it over to you. Pet therapy. Who let the dogs out?
Yeah, thank you for joining me today. I'm so excited, and I'm excited that it's January because I want this actually to be a very feel-good lecture because that's what pet therapy does. And the quote was just wonderful that Tim gave. But I'm hoping at the end of this that not only will you understand more about pet therapy, the differences of type of dogs that we use for different occupations, because they do treat it as a job, although volunteer. And then also at the end, I put a little montage that I'm hoping you'll get that feeling of seeing the faces and seeing Herbie that the patients or whoever his audience is for that day gets. That's what, and then you'll be starting January on a good foot or paw. Next slide. So let me tell you a little bit. Let's define animal-assisted therapy. And I'm talking about dogs today and Herbie, but I don't want to leave out the other population. So what animal-assisted therapy is, a goal-directed intervention in which an animal is incorporated as an integral part of the healthcare treatment process, or as I say, the healthcare team. Animal-assisted therapy is delivered or directed by a professional health or human service provider who demonstrates skill and expertise regarding the clinical applications of human-animal interactions. And pet therapy is not dependent on a specific therapy. So it's not the dog has to sit on your lap for 5 minutes, and then the next thing designed is sit on the floor for 5 minutes. Animal-assisted therapy is kind of the handler and the dog feeling out the audience or the patient or whoever it may be and doing what they need to do to be therapeutic. And that's what we've learned to do. And Herbie has taught me a lot. The animal-assisted therapy encompasses all types of psychological theories from psychoanalytic to behavioral. Next slide. So what animals are used? Since this isn't specific to just where we are today, I just want you to know canines are usually, the dogs are the main animals that are used in pet therapy for people. And what we're trying to address there are anxiety, nervousness, difficult treatments, depression, and that can come in the whole population just being hospitalized. And children who suffer from ADD, ADHD, emotionally troubled, or hospitalized and stressed, the animals and handler team are therapeutic. And the handler has to learn some issues too, although honestly, the dogs really guide the session. Interestingly, horses are a good match for children with disabilities like cerebral palsy, autism, or Down syndrome, and seeing those animals on a regular basis. Obviously, we don't do that at the hospital, but I do know some hospices have where the animals can be outside and be seen by either owners or as therapy animals. And then elephants, which we do not have any of either, have been used in some parts of the world for children with disabilities. And this was so interesting when I was reading about this, that they do have people that are, or kids or even adults who go to a zoo regularly and kind of develop a bond with that animal, if it's an elephant or whatever, to the point where when it's done regularly, the animal will recognize that person and come over and develop that therapeutic bond. And a little glass wall doesn't stop that. Children, when they're doing that, learn discipline and concentration in order to form a bond with the animal. There are a lot of distractions. And so that animal will cooperate with the child, like come over and see them. And that is a wonderful thing. Next slide. A little bit about history. So, I mean, dogs have been pets, and I always say every animal is a therapy dog, just some are certified and some are not. So, so we've had pets for so long, but the earliest record of actually animal-assisted therapy was in the 18th century at the York Retreat in England. And this was for mentally ill patients, and they sought not really to change any anxiety or whatever, but just to build morale in that place. So, and it seemed to work and went further on. So in 1860, the Bethlehem Hospital in England began using this practice for patients where they really visited on a regular basis. Sigmund Freud was one of the first people to believe in this therapy. He had a chow, which is pictured there, called Joe-Fi, and he believed that the presence of a dog had a calming effect on all patients, including children. So he actually, throughout his practice, had Joe-Fi with him. And he believed that when the Joe-Fi got closer to the patient, that they calmed down more and were able to have a calming effect and also a bonding effect, which included him because he was the owner of the dog. Next slide, please. Boris Levinson in the 1960s, which is a huge jump from where we were before. So, I mean, some people used it, but it was not anything that was solidified or really valued quite so much. But he discovered that he could reach a disturbed child in therapy sessions when his dog Jingles was present. So he did all his therapy, again, pretty much like Freud, with his dog Jingles present, observing the same kind of interaction where there was a calming presence. Levinson believed that the sessions where Jingles was there formed a bond of trust and developed a solid relationship with a child from then on. So in having that, I mean, that was part of the team. If you went to see Dr. Levinson, Jingles had to be there. And then in the US, it took a nurse, yay, in 1970, Martha Rogers provided the conceptual framework for some pet therapy intervention. And she founded the Delta Society in 1977, which began research with pet therapy and what kind of improvements we were making. So this is the key slide for me. Why are we doing this? What are the benefits of animal-assisted visits? Hospitalized patients, as we all know, encounter stressors that impact their experience and recovery. They're taken out of their regular place, even if they're held up in their homes these days with COVID fears. But all of a sudden, if you asked a patient about last year, if they were in the hospital, that's one of their major stressor points for the year. So our goal as a therapy team for Herbie and I, or any of the therapy teams that we have, is to create a therapeutic and healing environment that decreases stress and improves patients' experience. Now, how can we measure that we're doing that here? Well, we don't quantify it, but you can see it right there. I think both that little boy and the dog are smiling. So that's a child that's relaxed and happy, and maybe not be that way when he's in his bed and someone's looming over him with a treatment. So there are multiple controlled research studies that have shown that compared with baseline, patients have a significant decrease in pain, respiratory rate, negative mood state, and a significant increase in perceived energy level. Quantitative and qualitative findings support a decrease in tension, anxiety, and improved overall mood. And the key thing I love of those definitions is perceived energy level. It may not be a big difference, but it is to them because they perceive that this therapy changed them. Next slide, please.
Right. So here we've got our first question since the beginning. Research has demonstrated what physiologic effects animal-assisted therapy has on a patient. A, decreased pain. B, lower anxiety. C, increased perceived energy level. Or D, all of the above. And Lynn, while we're waiting for those responses to come in, I'll say that looked an awful lot like a Vizsla on that last slide.
Yeah, I don't know. It may be, I don't know. But
we have two in the house, and I actually oh, go ahead.
No, you go ahead.
I wore my dog tie today with Vizslas in honor
of
dogs and of Herbie. So
we'll have to get you a Basset tie.
There we go.
So these answers are perfect. I mean, you're listening and you're understanding, and probably many of you are pet owners. So that was excellent.
Great. Thanks to everyone for responding on that.
So one of the common things that I do want you to know about is what is the difference in these terminology: service dogs versus emotional support dogs versus therapy dogs. And there is a difference, and these terms are not interchangeable. Next slide. So we'll talk about service dogs first, and those are also sometimes known as assistance dogs, and they usually wear a jacket. They're trained to perform quantifiable tasks that directly ease the challenges associated with their owner's physical, psychiatric, sensory, and/or developmental disability. So they have an owner. they have a person. These also could be qualified for police dogs. You know, they say do not pet. Same thing with service dogs. Their job, and it, like I said, it is a job, is to be focused on their owner. Some of them, you know that they are service dogs that work with children. If a child is diabetic and becomes hypoglycemic or hyperglycemic, or seizure, or children or adults who have seizures, and the the dog can sense what's going on and alert the owner or the family. That's also a service dog. But they all, and then you see the ones that are just amazing, that are opening the refrigerator door, and that are you know, closing other doors, and, you know, pulling on things to open closets, and can really help with disabilities, both physical and developmental. The most common types of service dogs are ones like guide dogs, you know, that we hear for sight dogs, hearing, medical alert, mobility, autism service, and psychiatric service dogs. So there's a real range, and also a range of training for each of those dogs, which is specific. The Americans with Disabilities Act protects the rights of people with disabilities to bring their service dogs with them to most public places, including restaurants, theaters, shops, hotels, government offices, to most. So they still have at some places where it's restricted. But being a therapy dog, Herbie doesn't get to go to the movies or out to dinner, so he just hangs in the hospital and at the university. Next slide. Emotional support animals. Those are companion animals, again, directed with one person, who help their owners cope with the challenges associated with emotional and mental health conditions, either depression, anxiety, really any type of thing. And they provide comfort with their presence, if you're with their presence. So just by being there, they're doing their job. If you're a pet owner, you know exactly what we're talking about. They're not expected to perform anything, to do any special tasks related to their owner's condition, and they don't really have to have any behavior standards or training. Their presence alone is what's thought to provide the owner with solace and therapeutic benefit. So there's no kind of special training for these dogs. The Fair Housing Act requires that most housing units accommodate emotional support animals with appropriate documentation. So where some place may say we don't have animals here, if there's appropriate documentation, the Fair Housing Act has to adhere to that unless they have a special specification. Next slide. Therapy dogs are not service dogs, so they're not with one person. They're not performing specific acts for a person. Therapy dogs do not have the same special access as service dogs. They would like that, but they don't have it. And therapy dogs work as a trained and certified team. They have to have a handler, and they work in a variety of settings and gladly interact with many people. New paragraph. I'm like, thank you. So I just wanted to summarize this in a chart where there's service dogs, therapy dogs, emotional support animals. And we'll just go over there so again, you can really understand and even explain to people on what the difference is in these. So the ADA covers the rights to bring the animal into public establishments. That's only service dogs. You need to tolerate a wide variety of experiences, environments, and people. And that, again, is a service dog and certainly a trained therapy dog. An emotional support dog, again, is just being. They may live with disabled owners even if no pets policy is in place. Not 100%, but most, but that's both for the service dogs and the emotional support dogs. The primary function is to provide emotional support through companionship, and that would be an emotional support dog. I'm not saying that the other dogs don't do that, but it's not their primary function. Specifically, a dog that's specifically trained to assist just one person, and that is service dogs. I would say also emotional support dogs, although they can be emotionally support to the family, you know, again, calming other people in the family just by having them there. So it's not technically specific to one person. If they provide emotional support and comfort to many people, that's a therapy dog because they're designed to be out there. Thanks. Next slide. I see a question there. So Herbie is a therapy dog. So that's what we're going to focus on in a minute. Thank you.
All right. And therapy dogs are like service dogs and emotional support animals in what way? And just a reminder, because I'm seeing we've had some folks putting in the letter that corresponds to the answer in the chat. And you do need to go to Poll Everywhere for that, if you would please. And that's just pollev.com/UNCCN. It's up at the top of the screen as well. And that way we'll be able to see your answers. Thank you so much to everyone for trying to make sure that we see those answers. So in therapy dogs are like service and emotional support animals in what way? A, ADA covered to bring the animal into public establishments. B, trained or dispositioned to tolerate a wide variety of experiences. C, primary function is to provide emotional support through companionship. Or D, none of the above. Seems like we're really trending with answer B, Lynn. How are they doing?
So this is a little bit of a trick question, that they should be trained or dispositioned to tolerate experiences, but they don't have to be if they're an emotional support animal. An emotional support animal does not have to have any training. They obviously should, but so it really would go to none of the above. And if we can flip back to our chart.
Absolutely. And I'm glad you brought that up because I wondered about that. It would seem like that would be an important one for an animal that was going to be around a lot of different people, but you're telling us that's not required.
But the emotion, there's not a specific requirement of training or anything. That emotional support, that's why, and this is my least favorite topic, but that's why people bring dogs on the plane and they don't really have to have any training or anything. Yeah. So it's a little bit of a trick question, but your answer is actually right. They should be trained. They should have some training.
Okay, great. Thank you everyone for responding to that. And there's the next slide.
So now we are going to talk about specifically therapy certification, therapy dogs and therapy certification. So you can the therapy dog works in either a hospital setting, a school setting. At UNC, Herbie's worked at during exams as an emotional therapy dog, and the kids come and visit the dogs and they feel better, but a variety of type of things, but they're with a lot of people. He's with a lot of people. So you can't do that without being certified, just for safety and other reasons that I'll get to in a minute. But there are over 100 certification organizations. So for therapy certifications, the ones around here that are pretty popular are listed. But if you are interested in having to be a therapy dog team, what you need to do really is to find out where you want to work and then what certification they want. Because if you're certified by Pet Partners, Duke may not take that one. They do, but they may not, or a school system may not. So that's what you do, is find out first which certification. UNC used to be just Pet Partners, and now they have several organizations. So the popular ones around here are Alliance of Therapy Dogs, formerly Therapy Dogs, Inc., Bright and Beautiful Therapy Dogs, Love on a Leash, Pet Partners, which was previously Delta Society, which is one of the bigger ones, more popular, Therapy Dogs Incorporated, which was Therapy Dogs International. And then, as I said, depending on the area and where you are, those will change. And next slide, thanks. So what is therapy dog certification? Well, since the 1980s, there have been significant advances in the field of animal-assisted therapy and the use of therapy dogs or animals. Organized therapy dog groups provide educational material to volunteers. They screen both the volunteer and the dogs, and they provide liability insurance, which is so very important. That should be like blinking for the dog and the handler when they're volunteering in a therapy setting. When you're taking the dog to different settings all the time, and if someone steps on their foot and the dog snaps, I mean, they're trained not to do that, but, or a child throws himself on the dog. Herbie's had back surgery, so you have to be watching all the time, not just the people, but also the dog. So making sure the dog's not getting stressed. Therapy dog certification organizations are the expert in the field. It's their dedication that's organized in advance this work of therapy dogs, and their efforts should be acknowledged and appreciated. They do a really good job. You'll see the requirements in a minute. Everybody always asks me, well, what about the American Kennel Club? Where did they fall in? And they do recently have fallen in. They do not certify, but they do have training classes that for therapy dogs, which is a really great program because you can kind of see if your dog's into it. You know, you can take the class and do the things. And if the dog doesn't seem to be excited about that, you know that there are other things to do. But also the AKC recently has had a therapy dog title. So if you're volunteering for many hours and whatever, you can get a title, which is kind of a nice little reward from a big organization like the American Kennel Club. Next slide, please. So we'll talk a little bit about what that title is. So the purpose of this program is really to promote therapy dogs. And they want to reward their owners who've given time and help people by volunteering as a therapy dog and owner team. So the Therapy Dog Program awards official AKC title. So you get a title as a therapy dog who've worked to improve the lives of the people they have visited. And the AKC Therapy Dog titles can be earned by dogs who have been certified by AKC recognized therapy dog organizations. So again, they have a list of all the therapy dog certified organizations, and you have to be within one of them. You can't create an organization for yourself. They have to go through strict requirements too. And then the title becomes on how many visits, on the work, a representative of the work. There's nothing else to do on how they perform or rating the visits. It's just the idea that you're spending the time and the dog is volunteering that time. AKC does not certify therapy dogs, so it's not a certification organization again. And the training, but to do that is by qualified therapy dogs organizations. We took the therapy dog course and it was so very helpful. There was training there, and then they followed with some training afterwards on the site through the certification organization. But it really helps you to see if the dog, they take a walker and crash it, or they have a wheelchair that someone goes by, and to see how the dog reacts to, you know, harsh sounds, to noise, to crowding around them. And it gives a good hints and things to train, and also again to see if that's really something that this particular dog would want to do and succeed at. And they're the experts are the people who are certifying. Oops, sorry. Thank you. So dog therapy teams, we keep talking about teams. Now this is Herbie's. Now we're getting into Herbie. There'll be a lot of Herbie. That's his, at UNC, they give you a card, like a sports card, and you can give it to the kids, and it has some information on the back. And his information is that he's bilingual. I forget what that he does some tricks, and we'll get into that. And they're really fun for the kids, and all the dogs have them. A handler must be at least 18 years old, and they have to commit to the minimum required visits per month at that organization, albeit a school, a nursing home, the hospital. And usually you commit to 1 year of volunteering. Certification requirements, as we talked to, are driven by the facility. They'll tell you what organizations they will take for certification. They will do a background check on you. I don't know if they did one on Herbie, but he's pretty clean. COVID, flu, TB vaccination proof, and then MMR titers or vaccination proof, chickenpox vaccination or titer. So if you're not up to date on those, you go back in, and usually at hospitals, they will do that through the employee program, but other places you may indeed have to have a cost associated with that. The team is usually interviewed before it's certified, so they see the dog, they see the handler and how they interact, and then they have a written test just for the handler. Herbie didn't have to do that, but a practical skill test where they are grading both the dog and the handler. And Herbie may or may not have done better than me. Example of requirements for the dogs on a therapy team, they have to be at least 1 year of age. And this is in most places. These are examples. They've lived with the owner for at least 6 months. They're house trained. They've had rabies vaccination is current. And interesting, they may not be fed a raw meat diet because of bacteria. They have to have absolutely no history of aggression. If you have a dog who's bitten or shown aggression and then has been rehabbed with whatever type of thing, it's still not a good fit. It's not a good fit. And even if they are the friendliest, sweetest dog, if they have any history of aggression, they should not be in this program. Basic obedience skills: walk on a leash without pulling, sit, stay, come, leave it. Again, I go back to the American Kennel Club that has great programs, and they have a wonderful program called Canine Good Citizen, which is just these type of things, basic obedience skills. And then if you pass the Canine Good Citizen test, you get a certificate, and it's kind of fun for the dogs. I like all of these things because it's a team thing of gaining that type of thing. And the dogs are just as proud as the handlers when they pass anything. But I would really recommend for really any dog, the Canine Good Citizen program at American Kennel Club. The dog needs to welcome interactions with strangers. If the dog is shy or pulling back, again, may not be the dog's thing. It doesn't mean the dog is not a wonderful dog, but just may not be the job for them. They also have to go to the vet, an annual physical with a physical release and up-to-date vaccinations. And then most places have, or all places have, a performance kind of quiz where either in person or videoed. Now some have been, but also where they're observed so that they can be observed for safely doing things. So pretty many requirements. It's not just an easy thing you pop in with your dog. Next slide, please.
All right, and here's where we get to our next question. What is not a requirement for the dog to be part of a dog therapy team? A, house trained, B, rabies vaccination, C, raw meat diet, or D, basic obedience skills. So take about 10, 15 seconds if you would, and answer this. All right, really interesting information, and I know we're going to have some follow-up questions about that at the end. Lynn, how are they doing?
I mean, they're great. How wonderful it is that you guys are just listening to all of this program, but it is the raw meat diet because of the bacteria. So they do have to have basic obedience skills to be part of the dog therapy team, and house trained and vaccinated. But the raw meat diet is a requirement that that the certification teams put on for safety. But I mean, how great is it to give a talk and have people listening so hard? Thank you. Next slide. COVID, I'm obligated to tell you a little bit about COVID and what are we doing now. At the beginning of COVID, they did stop therapy animals because we didn't know how it was being spread. Now back at UNC, and I am not involved in it because Herbie has kind of aged out a little bit and is a little bit slower, but enjoying his retirement. But they do have the dogs that are going to specific places, and you're like, how can that be? How can that be? The handler must be fully vaccinated with a booster. Distancing for the handler. We always use, even before, you use antibacterial gel before COVID on you, on a child or a parent who's ever touching the dog, before and after. But interestingly, there's no evidence that viruses, including COVID viruses, can spread to people from the skin, fur, or hair of pets. Very interesting. Now, this is where I always branch off, and I'm going to just talk to you about something that I read I thought was interesting, and you can tell people at dinner. Deer. So white-tailed deer have a high rate of COVID. And even, I think it is in Michigan, they have like 60% of the deer there have COVID, and they're not really understanding why. Other places in North Carolina, it is about 40 or 50% of the deer have COVID. So don't ask me questions about it because I don't know why, but I thought it's good for the dinner table tonight. Just a very interesting, but it tells you that the transfer really, when we go back, it's not from the fur or the hair of pets. So just very interesting. Next slide. So risk, everything has a risk, every occupation. The biggest risk among pet therapy, obviously, is safety and sanitation for all parties. The animals are regularly screened for health and behavior. It's uncommon, but people can be harmed if unsuitable animals are used or not handled correctly. Again, with children, grabbing a big thing of fur, you have to be watching your dog. And I've often taken a child's hand and say, this is how, we do it gently, and, smiling at the child and doing it slowly. Herbie had, and so some animals are scared of children and just do adult populations, and that's perfectly fine. But the other thing that I would see too is that we were around kids who had trouble with impulse control, so screaming, and that didn't seem to upset Herbie. So he was good with those children. So they would pet him and then scream. It might say something about our household, but in any case, it was a benefit because Herbie, whereas some dogs would shy away, I would put Herbie in there, and it didn't happen very often, but that was one thing that he could do very well. We just have to be sure that everybody, including the patient or the dog or the handler, are all safe. Next slide. I just love this slide. So this picture. So this is the Aberdeen Airport in Scotland, and they use therapy dogs, and you can see all different kinds of dogs and looking away, looking toward the camera, just very cute. And the handlers usually, as you can see here at UNC also, wear something to designate that you are a handler and on the team, and the dog does too. Herbie has a ID tag, as do all of the therapy dogs. These are used for emotional, really, to use as therapy dogs for people who are scared of flying, people who are waiting a long time and getting a little bit cranky in the airport, or their flight was delayed. So those are the emotional dog teams. There are a lot of women. We have plenty of men and teams here, but everybody's smiling. Next slide. As the handler, you need to protect the team. Dogs get very stressed too. Herbie can work for about, he does these tricks, we'll show you, but he's about an hour, 15 minutes, and then I can see that he's getting stressed. He's looking at me more, he's panting a little bit, he's slowing down on his things, and we have to be very in tune to that, okay? Some dogs can work for 2 hours or 2.5 hours. So, like I said, Herbie does tricks. Other dogs go there, lie on a bed, and lie down. They are as effective as that dog doing tricks. They're just smarter. So they can get petted and relieve stress for patients just by being there. Pee and poop breaks, you need to do that before, but if you see your dog is stressed, there have big dogs who, get stress poop in the hospital, so you want to try to avoid that, and that can happen anywhere. Safe situation, make sure that the situation around is safe, that it's not too many moving parts or someone that's unstable going to fall and you're visiting has to go to the bathroom, you need to back away from that. the dogs work hard. And so setting a time limit and learning that time limit is good. And it's absolutely fine. Everyone understands that if you have a short visit or a long visit, it's up to you and the team. Next slide, please. Remember, there's volunteer. I will say that you don't get paid, but you really do. You get paid. Your heart gets paid big time. So you do get to make up your schedule with the organization. You adhere to the site policies. And then usually there are supervised visits in the beginning. So someone who's from the hospital usually somebody who's a handler comes and helps you with the type of things, even if it's just orienting to that area, where kids go, where you can visit, where you cannot visit. I will tell you, UNC is wonderful for that. So we were in the lobby once and there was a little boy who was very scared, waiting for a blood test. So Herbie went over and he played with Herbie. Herbie did some tricks and everything. And then they called his name and the boy looked terrified. So I said, wait a minute. And I asked, could Herbie go in with him? And they were like, yeah, that would be fine. And we got in there and he said, I want Herbie to do his tricks. I want him to do his rollover. I'm like, okay. I said, how many times do you want him to? And he's like, 30. I said, no, we can't do 30. I said, how many? I said, how about under 10? And so he said 9, which was really probably too much. But Herbie in a little tiny room did his little rollovers while that little boy got blood and did not shed a tear. And his face, but mostly his mom's face, was just absolutely rewarding. So I got paid that day. We got paid. Next slide. All right, Herbie's bio. So Herbie was a rescue dog. He was adopted at about 18 months old from the Georgia Basset Hound Rescue. They're all different kinds of breed rescues. And they're wonderful in that when they give you a bio on which dog, they tell you if they're housebroken, they tell you if they're food aggressive, they tell you if they like children or not, but which is very helpful. They're going to be very truthful because they want the dog placed well. Then he was placed in a foster care. I think Herbie ran away from somewhere like hounds do, because when we got him, he would sit down, he'd wait for his leash. He knew some manners and walked on a leash. So he was pretty good. We call him Herbie fully loaded because he came well. As far as he was housebroken because I didn't have the time to do that. And of course had a few accidents in the beginning as they adjust, but then fine. Then I took classes at the American Kennel Club with him, and I took basic obedience, and they're pretty strict there. They do a lot of training for, dogs to be competitive and show dogs and whatever. And there were a lot of big breeds. They all loved Herbie because he was a little funny and different. And however, everybody was very pleasant until at the end of the class when only 2 dogs graduated, and one was Herbie and the rest had to repeat the class. So then they weren't quite as friendly. But as I said, Herbie did the Canine Good Citizen program. Again, during all this training, you're practicing at home, short sessions, like 15 minutes twice a day. He did the therapy course through the American Kennel Club, and he did visits associated with that. And then as he got into this, and it was just, I was taking cues from him, he started doing his tricks. So he went through novice, intermediate, and advanced tricks. So we were able to share those in the clinical setting. You can crawl, get in a box, give high five. But I'm going to show you some of those. I have some video of his favorite tricks. So Herbie and all of us in our family are very food motivated. That really helps for training. If you have a dog that's not food motivated, you have to find something that is. So you do small treats and you reward each step toward the desired behavior. When he was learning to roll over, he had to get on his side and he got a treat. Then he had to do a little bit motion over, or I push him over, and then he get a treat. So at the same time, this has hindered him a little bit in that when we went to nursing homes and they were collecting the food trays in the hall and some were just on his level, and I'm trying to pretend I have control of this dog who's about to go into the food cart. I would have to push my body in between or something to keep him look like he was listening. So it can work to both ends. So again, also if I would go into a room and a child's eating a piece of pizza, I'd say, let's just move the tray over here because we would have to do that for a while for just for Herbie. But you reward each step of the desired behavior, and then you have to reward in the calm and submissive state. And when you're training a therapy dog or when you're in a therapy session, they're always in a calm, submissive state. They can wag their tail and be happy, but it has to be very calm. When you're training, then you slowly fade that lure that you have, the treat, and do the test, do no treats and get them to learn. Next slide. Okay, here's some of Herbie's tricks. He knows to roll over. Come on. And I'll show you, this isn't slow-mo, but he will, you get their head back first, although and then watch afterwards. I'm over on the left and he's looking directly at me. He knows where I am the whole time. Now he has to work a little harder because he's long, but he will be looking right afterwards at me. And then this is what he's famous for. Okay. Okay. Next slide. This is his favorite trick. There's a fire. Good. Stop, drop, and roll. So the kids love that. He also does it in Spanish, which was wonderful. I say, "I fuego," and he does that. And if you're in a room where they only speak Spanish, it's wonderful. Then they just really light up, both parents and children. Sleeping Beauty, another thing. We're going to do a magic trick. Abracadabra, abracadabra. You are Sleeping Beauty. Okay, stop. He's a natural. Next one. He also has to learn listen and be polite. Now, when he said the doggy's for sale, then he did look at me like, wait, what did I get myself into? But this is one of the other volunteers who sings and plays the guitar for patients. So he can team up with anyone. Next slide. Herbie has some special things. As you can see, his right paw there is kind of funny, and the kids would ask about it. He came like that to us. We call it his fancy paw or his special paw. And it's a wonderful thing because it doesn't bother him or anything. And he's a little different, and that's great. He also, that's him looking ecstatic, just so you know, for the future pictures. He's really happy there. I started an Instagram account when he started to do the therapy because I would visit, and especially with kids, they say, can you come tomorrow if they were inpatient, or will you be here the next time? And this gave them a connection where they could see Herbie doing different things. And I would get comments from them and everything. And he has over 5,000 viewers. I have been not running his account recently, but I need to get back to it because I've been asked. Next slide. This is more from his Instagram accounts. These are pictures from Ronald McDonald House, but how that runs. But you look at the faces, and that's what's the best. That is what the best is. And so all of these, of course, you're asking because of HIPAA. And then these are some of the comments. You know, your life is awesome. I love you, Herbie. You have an amazing heart, and it just always bringing joy to others. It just warms everybody's heart. Different needs for different audiences. Herbie worked with children, so we did a lot of visual, sensory, the tricks, and just hanging out. And if there were a group of kids, I would say, you're going to now see the amazing trick show. You can't see it on TV. This is not repeated anywhere. And the kids would just sit down automatically and love seeing all the tricks. Adults, they mostly want to just hang with the dog and pet the dog. I'm going to give you this little montage of pictures to try to get you to feel that, what I feel when and Herbie feels when we go around and do our job.
One light, one sun lighting everyone. One world turning everyone. One world, one world home for everyone. One dream, one song heard by everyone. One love, one heart warming everyone. One hope, one joy, one love filling everyone. One light, one sun lighting everyone. One light warming everyone.
It's so important to make someone happy. Make just one someone happy. Make just one heart-to-heart you. You sing to one smile that cheers you. One face that lights when it nears you. One girl, you're everything. To fame, if you win it, comes and goes in a minute. Where's the real stuff in life to cling to? Love is the answer. Someone to love is the answer. Once you found her, build your world around her. Make someone happy. Make just one someone happy, and you will be happy too.
So thank you so much for joining me today. I will give you one quote that I got from someone when I came into the room. You always have, there'll be some people say, no, I don't like dogs. So you go to the next room. And I said, I have a dog. Would you like to see him? And Herbie walked in and she looked and she said, I prayed for this. And your heart soars. I never walk to a room someone says that, but it's just what the magic that they can do. I love pet therapy. It's low tech. It's very low cost because we're volunteers. It improves mood of everyone around, as you could see from those smiles. And as I didn't say before, but we do a lot with the staff too. And it's so meaningful to the hospitalized patients and to the staff. So it's just something that is in a complete passion. And I hope that some of you will be interested too. Next slide. Thank you. I hope this gave you all a break and that you learned a little bit about therapy animals, and most of all, that Herbie and I made you smile, because that's the goal of our therapy team. And that's what we do. Thank you mostly to Herbie, because he has incredible patience with me and he believes in me. And without a doubt, he was the leader of our team. So Happy New Year to all. And I'd love to answer a few questions.
Lynn, thank you so much. You definitely brought a smile to my face, and I'm sure to most or all of our viewers. Do we get to say hello to Herbie?
He's over here. he slept through it, but now I can bring him over. Herb.
Oh.
Yeah, he's taking a little nap in his retirement.
Oh my goodness.
But he's the best. He is the best.
Oh my goodness, what a sweetie. Thank you so much. Well, this is wonderful, and I love that video. Tremendously informative presentation. Let's take a look at those questions. We do have them starting to come in now. Any suggestions for a miniature horse?
I mean, I think they probably can't do that in the hospital because people would be swarming. People would be swarming. But if you had a miniature horse, I think hospice would be my suggestions, because they have windows where they can, but I think lots of people say they miss their horse, but I think inpatient hospice would be a perfect thing. There's an inpatient hospital in Pittsburgh and there's one in Durham.
All right, thank you. Another question, let's see, there we go. Is the pet therapy program at UNC hospital-wide, or just for specific populations or units? Another great question.
Yeah, it is a great question. I think they work for most units. I know that they can go into the ICU, but I think some but you're talking specifically about UNC. They do not go to the burn unit. There's some places, and then depending on the they don't go to the psychiatric units. But I did children, but there were many places that you can go. And lots of times I would tell people just working as a nurse in the hospital, if we got to talking about dogs or whatever, I'd say call volunteer services and see if a pet can come up here.
Great. Thank you so much. We had a few questions that have been coming in on the chat as well. Thank you for the great presentation. Does the AKC award titles to non-pure breeds?
Oh, yes. Herbie doesn't have any papers. So, he doesn't, he looks like a purebred basset, I'm sure he is, but absolutely. Absolutely.
Great. Thank you. Another question. I'm a nurse at UNC Lenore. I also registered with Pet Partners in 2020. Do you have suggestions for growing the pet therapy program? We only have 2 dogs in ours.
Yeah, it's hard now because people are scared. It's hard to get people in hospital. So I think hopefully when all of this over, I think it's just really hard now. People are taught not to touch anything. And so I think this is a hard time. But again, I think, things like this or programs or talking it up, but it is a difficult time right now.
All right. Well, we are past the hour, and it looks like that we've reached, I hope we've gotten to all of the questions. Let me go on and just mention a few other things in closing. We want to thank the people of North Carolina for their generous support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center and our program at the UNC Lineberger Cancer Network. We want to thank Mary King, Veneranda Obore, John Powell, Oliver Marth, Jason Paler, and Andrew Dodgson for all the hard work they do for so many things, including this presentation today.